Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Restorative dentistry using the freedom and centric concept does not require elaborate tracings of mandibular border movements. For this reason, dental restorations can be completed in a semi-adjustable articulator. This segment of the patient's occlusion has been reconstructed. The occlusion has been adjusted and the restoration made to conform to the freedom and centric which has been established in the mouth. The articulator used is the Hanau H2 XPR. This instrument has some approximation for mandibular function and has the capability to allow freedom in centric. These positions are controlled by the Schuyler pin on the incisal table FC pin. In this approach, centric relation is used as a point of reference for another position to accommodate for function. With this head frame, the movement of the mandibular incisal point is monitored electronically on an oscilloscope. While chewing on a beef stick, the patient's functional contacts of the masticatory system occur in or very close to centric occlusion. Centric occlusion is considered the terminal position for the open-close clench and the closing chewing stroke. These tracings demonstrate the delicacy of mandibular function. In order to guarantee harmonious masticatory function in these chewing cycles, a precise occlusal structure has to be developed. This is achieved by the following wax-adding technique. The first step in the development of a functional occlusion is to analyze the opposing occlusion for potential long centric stops. The buccal surfaces are marked in pencil to locate the future cusp in the direction of its opposing centric stop. These lines are extended on the occlusal surface for each of the buccal cusps. The patient has had an occlusal adjustment with freedom and centric established. The center of the cusp is aligned in harmony with the other remaining mandibular cusp tips and the options given by the opposing arch. The mandibular supporting cusp cones are developed using the P.K. Thomas waxing instrument and a wax-adding technique. Red wax is used for this procedure. Some adjustment in the opposing occlusion may be necessary to accommodate freedom in centric and eccentric movements. The height of the cusp cone to be waxed has to be estimated by checking the clearance between the casts. The cusp cone is built slightly higher and checked for contact. Contacts are confirmed with zinc stearate. All buccal cusp cones are developed in centric relation to contact the opposing teeth in a position that allows freedom in centric and guarantees a stable CR position. The waxed cusp cones are checked for their harmonious alignment in the mandibular arch. This harmony is expressed in the curve of Spee and can also be matched by superimposition with the other side. The articulator is now moved into excursive movements, and the waxed structures are checked for their clearance. The articulator is now dialed to centric occlusion by turning the PR adjustment to the appropriate setting. The supporting cusp cones are examined for their contact relation in centric occlusion. In some cases, an adjustment in the opposing dentition is needed to provide a relatively flat area for CR and CO contact. In others, the waxed cusp cone is made broader to allow contact on the marginal ridges. Here, wax is added to the mesial area of the cusp cone. CR and CO contacts have been achieved. The next step is to establish centric stops with the opposing supporting cusp of the maxillary arch. As with the supporting cusp cones, the centric stops are first developed in centric relation. Therefore, the articulator has been dialed back into CR. Wax is added opposite to the upper cusp tips until centric relation contacts are established. The remaining centric stops are developed similarly and checked for positive stop. The shape of the centric stop is now flat and saucer-shaped. Freedom in centric is best seen in a cast where the right half has been removed. There is contact with the maxillary supporting cusp in centric relation and centric occlusion. When moving into protrusion, disocclusion occurs between the waxed structures and the opposing dentition. Similarly, there is a lack of working and balancing contacts on the newly waxed structures. In the next step, the non-supporting cusps are waxed. These are shorter and closer to the edges of the occlusal surface in comparison to the supporting cusps. The same waxing technique as for the previously waxed red supporting cusp is used, but no contact on the opposing dentition is made. Green wax is used to differentiate non-supporting cusps from the red wax supporting cusps. The mandibular non-supporting cusp cones must be positioned to avoid interference of the opposing cusps in all excursive movements. Green wax is drawn out to the periphery to form the cusp and marginal ridges. Care is taken not to carry wax on the cusp cones, otherwise interferences will be created. Several increments of wax are needed. The marginal ridge is developed to the height of the adjacent marginal ridge. The wax is extended to the red centric stop. By adding green wax to the central part of the cusp cone, the triangular ridge is formed. In these steps, care is taken not to alter the height of the cusps, nor the position of the cusp tips by adding wax to the previously established contact. The saucer-shaped centric stops for freedom in centric should maintain their original dimensions. By reheating the triangular ridge with the number 2 waxing instrument, the necessary convexity is achieved. After completion of each triangular ridge, lack of contact in centric and excursive movements on these newly waxed structures is checked. Axial contours are best achieved by turning the cast sideways. Sufficient wax is added to complete the buccal convexity. Some carving may be indicated. After completion of the axial contours, the outlines of the wax teeth are compared to the remaining teeth. The final smoothing is done with finger burnishing. Now, small increments are added to the remaining occlusal surfaces. As before, laying down wax is avoided on the newly developed triangular ridge, the cusp tip, the crest of the cusp, and the marginal ridges and the saucer-shaped centric stops. Fissure carving is done with the number 3 waxing instrument. The outline of the central fissure and the secondary anatomy is defined so that the carving resembles natural tooth morphology. The natural tooth on the opposite side of the same arch is used as a reference. The depth of the fissures are also defined using this procedure. Finally, a reheating is needed to touch up the waxings. This is done with the sharp end of the number 2 waxing instrument. The instrument is lightly buried in a portion of the occlusal wax surface until a smooth convex surface is created. As the instrument cools, it is withdrawn and reheated. Freedom in Centric is established. The occlusal surface is now complete. Each supporting cusp tip contacts in CR and CO. Each long centric stop shows freedom in centric with its saucer-shaped contact. A natural tooth appearance is achieved. These concepts are then incorporated into the patient's occlusal reconstruction.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.